GHK copper is a peptide that is widely known for skin glow and regeneration, but its effects go far beyond that. The moment we are born, we already have GHK copper circulating throughout the body. It can be found in plasma, saliva, and urine. However, as we age, levels begin to decline, and in fact, at age 20, circulating levels are around 200 nanograms per milliliter, but at age 60, levels may decline to around 80 nanograms per milliliter. So in this module, we will discuss what GHK copper is, pharmacokinetics and pharmacodynamics, how GHK copper affects multiple cellular pathways, gene expressions and regenerative signaling, wound healing, angiogenesis and tissue repair, stem cells and cellular regeneration, hair growth and follicle health, antioxidant and anti-inflammatory effects, cancer-related research findings, how GHK influenced the hallmarks of aging, copper toxicity, safety and lab monitoring, dosing, half-life, and administration. Let's get started. GHK is naturally occurring tripeptide composed of three amino acids, glycine, histidine, and lysine. It has strong affinity to copper and binds tightly to copper ions. So one of its primary function is delivering copper ions into the cells where they can support critical biological processes. Now, why copper is important? Copper is an essential cofactor for several critical enzymes in the body. One of them is the lysyl oxidase, an enzyme responsible for stabilizing collagen and elastin. Now, these are the proteins that provide strength, structure, and elasticity for our tissues. Copper also plays an important role in antioxidant defense system, includes the superoxide dismutase, an enzyme that helps neutralizes free radicals and reduces oxidative stress. But GHK copper is doing much more than simply transporting copper. It acts as a signaling molecule that helps regulate gene activity and can influence the expression of over 4,000 human genes. It doesn't change your DNA. Instead, it influences which genes become more active and which genes become less active. It can turn on genes that are involved in regeneration, tissue repair, collagen production, elastin production, immune regulation, antioxidant defense, and cellular maintenance. At the same time, it can turn off genes that are associated with excessive inflammation, fibrosis, oxidative stress, and tissue breakdown. So let's talk about one of the most recognized benefits of GHK copper, and that is the skin. It stimulates fibroblasts, which are the cells responsible for producing collagen and elastin. So, collagen is a key protein in the body that provides structural support not only for the skin, but also for tendons, ligaments, blood vessels, cartilage, and connective tissue. Now, elastin is another important protein that allows tissues to stretch and return to their original shape. Now, as we age, production of both collagen and elastin gradually declines. By supporting fibroblast activity, GHK copper may help maintain skin structure, elasticity, and overall tissue integrity. So the other components, it helps the MMPs. It stands for matrix metalloproteinase. These are the enzymes responsible for breaking down the damaged extracellular matrix component so that new tissue can replace old tissue. So when you use GHK copper, the first few weeks you might go through this ugly phase or skin becomes dull because GHK copper activates MMP1 and MMP2, which break down old damaged collagen so that before your skin can build new collagen, it has to clear out the old matrix. Now, during this phase, the skin temporarily look less bright, typically for about a few weeks. So this is just part of the skin's detoxing and remodeling process. GHK also supports the production of glycosaminoglycans. These are the long sugar molecules that make up an important part of the extracellular matrix. Their job is to attract and hold water within tissues. One of the most well-known example is the hyaluronic acid. By supporting glycosaminoglycans production, GHK copper help improve hydration, cushioning, tissue flexibility, and skin volume. Now let's talk about immunity. Another fascinating area of research involves stem cells. Throughout the body, stem cells exist within the tissues and the bone marrow. Research suggests that GHK copper may activate pathways involved in stem cell function and tissue regeneration. These cells can develop into specialized cells needed for repair and recovery, helping maintaining healthy tissue throughout the body. Now, research has also shown promising effects on wound healing. Both animal and human studies suggest that it may support wound repair through multiple mechanisms. One of those mechanisms appear to promote angiogenesis through the pathway we now know VEGF, or vascular endothelial growth factor, which is the formation of new blood vessels. So this formation of new blood vessels help with delivery of oxygen, nutrients, and immune cells to the injured tissues, which creates an environment that supports healing and recovery. At the same time, fibroblasts migrate into the injured area, which helps with rebuilding tissue and support wound closure. Its anti-inflammatory effect may further support healing process by reducing excessive inflammatory signaling that can interfere with the repair. So another area receiving attention is the hair regrowth. So researchers suggest that GHK copper may increase the size and activity of the hair follicles. Also through angiogenesis, which is the blood vessel formation around the follicle that may enhance nutrient delivery and support follicular health. GHK copper also supports antioxidant defense system. It increases the activity of antioxidant enzymes such as superoxide dismutase, which helps neutralize free radicals and reduce that oxidative stress. It has also shown effects on glutathione-related pathways, helping cells better defend themselves against oxidative damage. One of the most intriguing areas of research involves cancer-related gene expression. So these findings come from in vitro studies, so not human trials. Studies support cell apoptosis, meaning ability for cells to die instead of going through senescence, which can potentially cause abnormal cell growth. It also increases the activity of dozens of DNA repair genes. It may help cells repair genetic damage before it accumulates. In addition, it appears to turn on genes that are involved in protective pathways, while suppressing pathways associated with abnormal cell growth. Some studies even suggest that blood vessels may interfere with the blood vessel formation that tumors need to grow. So taken together, these findings suggest that GHK copper may influence several pathways involved in cancer biology, including apoptosis, DNA repair, gene regulation, and angiogenesis. However, these findings remain preclinical and should not be interpreted as evidence that GHK copper treats cancer. Because of these mechanisms, GHK has gained attention in longevity and healthy aging research. While it does not directly target all the 12 hallmarks of aging, researchers suggest that it may influence several of them, including that stem cell exhaustion through waking up the dormant stem cells, genomic instability through DNA repair and cellular maintenance, epigenetic alteration by shifting gene expression toward a more youthful pattern, loss of proteostasis through MMP regulation, mitochondrial dysfunction through copper-dependent energy production, altered intracellular communication between immune cells, fibroblasts, blood vessels, and repair pathways, and reduction in cellular senescence, and most importantly, the chronic inflammation through suppression of NF-kappa B signaling. And this is why GHK copper continues to be one of the most studied peptides in regenerative medicine and healthy aging research. Now let's talk about copper toxicity. So one of the common concerns is whether GHK copper causes toxicity. Copper makes about 15.7% of the GHK copper molecule, so a 2 milligram dose contains only about 0.314 milligrams of copper. For comparison's sake, adult needs about zero point 0.9 milligram of copper daily, and the average diet provides about 1 to 1.4 milligram per day. So the copper from GHK copper is only about 20 to 30% of what most people get from food. The upper safety limit for human consumption, both dietary and medication combined, is 10 milligram per day. A 2 milligram dose of GHK copper provides only equate to about 0.314 milligram, which is only about 3% of that amount. The other consideration is individuals with Wilson's disease should avoid copper supplementation. So, Wilson's disease is a rare genetic disorder in which the body cannot properly eliminate excess copper. So, as a result, copper accumulates in the liver, brain, and other tissues, increasing the risk of copper toxicity, even at amounts that would be well tolerated by most people. Based on this available data, GHK copper doses are unlikely to cause copper toxicity in healthy individuals. Now let's talk about injection site, why it stings, and is this normal? GHK copper can sting because the solution is slightly acidic, which usually the pH is about 4 to 6, while your tissue pH is about 7.4. So this temporary pH difference can activate pain receptors and cause the burning, tingling sensation. The abdominal area may be the most sensitive area because it contains more superficial nerve endings. To reduce that discomfort, these are the things that you need to do. Inject slowly to prevent pulling under the skin. Gently massage the area afterward to help distribute the solution. Consider alternative injection sites such as your thigh, your hip, your glute, which some people tolerate better. And again, avoid the abdominal area. So, under the physician's supervision, additional bacteriostatic water may be added to dilute the solution and reduce that irritation. Now, let's talk about the dosage. The half life of GHK copper is about 30 to 60 minutes. Dosage is about 1 to 2 milligram, 5 days on and 2 days off. There are also laboratory markers that you need to check, such as serum copper to measure the copper levels in the blood before you start the therapy. Ceruloplasmin, which measures the main protein that transport the copper throughout the body. Liver function tests such as your AST, ALT, ALP, and bilirubin. The liver regulates copper metabolism and excretion, so monitoring this will give you a good baseline. Iron panel, like your ferritin, iron, transferritin saturation. Copper is required for proper iron transport and utilization. Now, zinc. High levels of zinc can reduce copper absorption. Complete blood count. Copper plays a role in red blood cell production and overall blood health. And then HSCRP, or high sensitivity C reactive protein. This is important because it measures systemic inflammation and may help track changes in inflammatory status over time. Thank you for watching, and as always, this is for educational purpose only and not medical advice. Please like and subscribe, and if you have any comment or question, please write your comments down below and I will make sure to answer them.